Thanks for listening to the Wild Health Podcast. For the foreseeable future, you're not going to hear our normal intro or outro here. We're going to be releasing episodes very frequently as things are changing. This channel will be used for a very specific purpose. Number one, to communicate with our patients. We're somewhat overwhelmed, and the more we can communicate breaking news and recommendations from us to our patients all at once, the better. So if you're a patient, we're here for you if you need us, but if possible, please tune in here so we can both keep you up to date and conserve our time for the most critical tasks. Feel free to share this with friends and colleagues as well. Number two, we've organized as a group. We have infectious disease specialists, ER doctors, critical care doctors, and in total dozens of MDs, PhDs, and frontline clinicians who are going to be constantly evaluating the news and emerging evidence. We're then going to summarize and translate that for you here every day on the podcast. The speed of change with the circumstances will make us look foolish at times, but we're committed to pouring all of our resources and energy into doing what we can to help and make a difference. You can also follow our updates at wildhealth.com or our Instagram account at wildhealthmd. And if you're a patient, we're here for you. Please tune in here for the updates and let us know how we can help.
Hey everybody, welcome back to Wild Health COVID Update. We're going to start off today talking about the situation report in the United States. So the latest numbers from the CDC show that Tuesday evening there were 54,453 cases with 737 deaths in the U.S. That represents a 23% increase in cases and a 35% increase in deaths since the previous day. The current case fatality rate is still at 1.35%, which has been similar to previous days and much better than what's being reported in Italy at 7.2%. As of this afternoon, there's 64,107 cases and 893 deaths in the United States.
Data from the Financial Times shows that the U.S. continues to have more cases than any other country, including China, did at the same stage in the pandemic. However, in terms of deaths at the same stage, the United States continues to remain behind Iran, China, and Italy. Spain's death rate continues to rise more rapidly than any other country, approximately doubling every 2 days. Spain's death count has overtaken China's to become the second highest in the world after Italy. Experts now say that the U.S. and Spain are likely the next epicenters. Here in the U.S., Dr. Deborah Birx, the White House's coronavirus response coordinator, reports that COVID-19 is spreading much faster in New York City than anywhere else in the country. The rate is 5 times higher than in other areas. 1/3 of the cases in the United States are in New York City alone. The White House has advised anyone that has passed through New York City recently to self-quarantine for 14 days. In California, Governor Gavin Newsom has said that California may be short 17,000 hospital beds if the spread of the virus continues on its current trajectory. The pace of testing has remained slow. Although the state of New York has half the population of California, it has conducted more than twice as many tests as California. New York has 3,000 ICU beds, and Governor Cuomo today announced that he believes they'll need between 18,000 and 37,000 ICU beds, so anywhere between 6 and 12 times the number of ICU beds that are available. Tonight, I'll be speaking with Dr. Poonam Desai, our Wild Health New York physician. Dr. Desai is 26 weeks pregnant and has been working shifts in the emergency department and has tested positive. We're going to be talking with her and 2 of our OBGYNs about risks in pregnancy and if you're considering becoming pregnant, what you need to know and what you need to do.
In literature updates, the American Heart Association published in Circulation an article entitled Coronavirus Disease 2019 and Cardiovascular Disease. This was released on the 21st of March. They basically go over cardiovascular disease and its prevalence in COVID-19 and then also discuss some of the potential reasons that it might be higher. And in general, they found that approximately 7% of people who contract COVID are actually getting myocardial injury. This is presumably in the form of myocarditis, which is basically just a viral infection of the heart. And it's unclear why exactly people with cardiovascular disease or hypertension are more at risk, but they think it might be due to an increase in the ACE2 receptors, which is the receptor that the spike protein of the coronavirus attaches to get into the cells. This is present, these receptors or this enzyme ACE2 is present in lung tissue, which we've talked about before, in the gut, but also in heart muscle as well. So that might be part of the reason. Also, not necessarily literature, but something that I wanted to bring to everyone's attention is something called Folding at Home. Folding at Home is a biomedical research lab that's using the computing power of volunteers to help run simulations and basically build protein structures so that we can better understand how this virus functions. They typically use their supercomputing power, which is said to be stronger than 7 of the fastest world's computers put together. They typically use that to help find cures for disease, help figure out why bacteria mutate. Right now, they're basically taking all of that power and they're directing it directly towards COVID and trying to help understand how this virus works and how it interacts with human cells to invade and replicate. So go to www.foldingathome.org and you can donate your computer's time when you're not on it to help fight the disease.
Yeah, this is a complicated machine, this virus, and we talk about that tomorrow some with Dr. David Sinclair on our podcast that will be released tomorrow morning. But this is a really cool way. A lot of people want to know how they can help, and this is something that you could actually do. You could use the excess computing power that you have at home. We have some questions from listeners. The first one, Mike, is do you think population density is a major factor regarding a spike in cases and therefore deaths, i.e. New York City versus Cincinnati? Or should we assume the risk is the same across the country?
I think we've seen that the risk is different depending on your environment, and that I think includes your ability to socially isolate. I don't know that population density has been shown to be directly related, but I would assume that in some degree it has to be. It's harder to socially isolate when you're in much closer quarters with people. That being said, there's other factors that are involved. There's temperature, there's humidity. We talked about that with Dr. David Sinclair when that'll be on our podcast tomorrow. So there is a lot that goes into it, but certainly the success of social isolation is probably the most important factor right now.
Yeah, if you look across different states and geographic regions, it really doesn't make sense to talk about cases and deaths in the United States like we do at the beginning of this. It's just vastly different from area to area. And even among states with similar density, you can see the effects of different measures that are taken. If you just compare cases, for example, in Kentucky with that of Tennessee, very similar populations and similar kind of density in general. It seems that the actions of different governors and states and local municipalities are having a big difference in the spread. So it does seem that some of these things that we're doing are actually working. The next question are supplements and behaviors for the masses with limited budgets. That's what the question is titled. So the question is, for most Americans, NAD is too expensive. Most people are not going to be able to measure lactate and do a perfect zone 2 workout. So using the 80-20 type of approach, what would you suggest for the long haul of the next several months that people can do at home? I mean, I think we've talked about this, but really just focusing on your sleep, good hygiene, social isolation. If you do want to do more than that, there are several supplements that may help. You can listen to previous podcasts we've done on this, but some of the less expensive ones that you could pick up are things potentially like vitamin A, quercetin, zinc, and then it seems maybe melatonin. There's some interesting data on that. Those are things that are easy and cheap and over the counter. Now, you do not want to take large doses of those. Again, just the regular recommended dosage. By taking 4 times as much, you're not getting 4 times the effect. So remember that. Do not cause yourself toxicity by taking a large number of those. We have kind of our recommended supplements published in different places. You go to wildhealth.com, you'll see kind of the general immunity pack that we supply for our patients. Most of these are still available. You can get them online. So those are a few that are low risk that you could potentially look into. Speaking of supplements, somebody asked, how many milligrams of quercetin do you suggest?
Yeah, so we know that quercetin inhibits viral replication at various stages, basically blocking the virus from getting into the cell. The problem is that most of these studies are in vitro, so it's sort of challenging to extract that concentration of quercetin and give people a specific dosing range. If you were a mouse, We know that giving you about 50 milligrams per kilogram would decrease your risk of contracting Ebola. But at this point, there's no specific data on humans in CoV-2 or COVID-19. And there's not really a lot of data specifically fighting viral infections for, actually in humans rather than just in cells or in cell culture. So I guess we would recommend the typical dose range, which is anywhere from 500 to 1,000 milligrams per day, without really any significant literature backing this up. But we do know that dosage is safe. Multiple studies have shown that any dose less than a gram a day is safe, and you really have to get up to around 3.5 grams a day to even start to see any renal toxicity.
Yeah, we know for sure that if you're a mouse and trying not to get Ebola, that 50 milligrams per kilogram works. So I don't know how much we can extrapolate that to what we're doing now. I'll tell you, myself, I'm taking about 500 milligrams to a gram per day. I feel safe at that dose, and I feel like I'll probably get some results. A couple more questions. Is there any evidence that EMFs or microwaving food have an adverse effect on longevity? I don't think we're going to dive into this. I think we do want to have a specific EMF podcast in the future, but not during the pandemic. And I think that's all the questions for today. I guess the last thing I would end with is that for some reason today, I actually feel, even though I'm looking at the news and the death rates are going up, the World Health Organization is talking about the pandemic accelerating, I just feel more optimistic today. And I think as I reflect on why, I think it's because 2 weeks ago, we could see what was going on in the front lines. We saw the numbers. We could feel this coming, but I felt like not enough people were taking it seriously. Whereas in the last few days, I kind of feel like we're finally all on the same page, and we're starting to have all of humanity ready to put our significant resources towards fighting this. So just me personally, I feel more optimistic today, even though the numbers aren't great, than I did a couple weeks ago.
Yeah, and hopefully we can use the data that we're currently getting out of New York as, sort of a calling to the rest of the country to stay strong and continue with social isolation, not to go outside, and try to prevent the uptick that we're seeing in New York and the other 49 states in the country.
Yep. So thanks for listening tomorrow morning, Dr. David Sinclair, and then we'll have another update for you tomorrow evening as well.
Thanks so much for listening to this COVID-19 update. Please send us your questions or follow along on Instagram and Facebook at Wild Health MD. And just to be clear, this is not medical advice. No patient-physician relationship has been established, and this resource is really for general informational purposes only. And finally, if you want to spread the word, please send this podcast to friends and family and give us a review on iTunes. Thanks again, and stay safe.